Good afternoon. Welcome, everybody. My name is Christine Parboni. I am the Director of Postgraduate Training here at the University of Maryland. On behalf of the School of Pharmacy, I want to welcome you all. Welcome to all of our new residents and fellows in the state of Maryland. Welcome to our Pharmacy Hall building. Hopefully, we'll see you all a lot this upcoming year as you help us with some teaching activities. Also wanted to give a warm welcome to all of our program directors and preceptors and other faculty that are around. This is an annual event that we do, and it's exciting to have a whole new set of presentations and hopefully some great education for you all to help you in your upcoming year. These topics are geared to help the educator in us. I say pharmacists are all educators, whether you're educating your patients, students on rotation with you, your medical teams. So we're all educators, even though we might not all go to school for education necessarily, because you all had pharmacy schooling background. But hopefully this is helpful presentations as you do some education, whether it's precepting or teaching in this upcoming year. So to start us all off, I am pleased to introduce to you Dr. Zach Noel. He is an associate professor in the Department of Practice, Sciences, and Health Outcomes Research here at the School of Pharmacy. He obtained his Doctor of Pharmacy from the University of Kentucky College of Pharmacy in Lexington, Kentucky, and he completed both his PGY1 and PGY2 in cardiology residencies at UK Healthcare in Lexington. He's a board certified cardiology pharmacist, and he is also just completed his Doctor of Philosophy degree in Health Professions Education here at the University of Maryland, Baltimore. Dr. Noel's clinical research interests include arrhythmias, antiarrhythmic drugs, and anticoagulation, which hopefully we're not actually talking about today. And he has additional research interests in pharmacy education, motivation, and cognitive load theory. And that's what he's going to talk to us about today with Too Much, Too Fast, using cognitive load theory to transform your presentation. Thank you, Dr. Noel.
Little does Dr. Parboni know that we are going to talk about arrhythmias slightly, but it's all the things I do wrong when I teach arrhythmias. It's not actually anything I do right with it. So thank you for being here this afternoon. My name is Zach, and I'm looking forward to talking with you all today. I've given this presentation about 6 times, and I love it every time I give it. And one of the biggest reasons I do is because it's immediately applicable to what you're doing, whether you're educating patients, students, residents, doing your PT rounds, or some other sort of education. There are definitely concepts from this that you can apply. If you haven't already, scan the QR code, and there are some kind of pre-questions that you can sift through and answer. We're going to revisit this at the end of the presentation, as well as midway through. So this is the obligatory learning objective slide, and whether or not you recognize it, when you saw this slide, your immediate reaction was to not read it, but actually look away. Which I think is very fascinating, right? So why is that? Why is it that when we see something like this, our minds immediately direct our attention elsewhere? The reason for this actually has to do with cognitive load and cognitive load theory, which is what we're going to talk about today. This is the same slide, just dressed up with kind of better font, better spacing, and a little bit more care and attention. Now, this might seem like a small difference, but when we're talking about learners in the classroom or on your rotation, or maybe even a patient that you're at the bedside with, this is the difference in them paying attention to the next however many minutes that you're talking with them versus not paying attention. And so we're going to talk about cognitive load and the cognitive architecture, but we're going to spend most of the time talking about how do we apply this. At the end of the day, that's, I think, the most important thing that you all will gain from this presentation is how we apply it. And then I've got some case scenarios from prior residences presentations that we're going to use with their permission. Stephen Chu from Stanford University once said, to be effective, any teaching method must be grounded in the cognitive architecture of the human mind. This isn't something that we learn a whole lot about in pharmacy school. And so I think it's prudent that we learn about it at some point, given we're all educators, as Dr. Parboni pointed out, in some way, shape, or form. So I want to start with an activity, and don't worry, this activity does not require you to talk to your neighbor. It'll be okay. It does require math, though, and I know that's not exactly what you want to do right after lunch, but it'll be a fun game and it'll be easy, I promise. All right, so I have instructions up here for you. On the next slide, I'm going to give you several numbers, and I want you to add the numbers, subtract 5, divide by 2, and add 1, okay? So add the numbers, subtract 5, divide by 2, and add 1. Are we ready? All right. Add the numbers, subtract 5, divide by 2, and add 1. All right. How many of you think you have the right answer? All right. Who got 16? Nobody got 16? What did you get? Who got 11? Raise your hand. All right. Who got something else? It's okay to be wrong. Say it with confidence. What other numbers did you get? No one wants to say. All right. The few of you that did get 11 got it right. The reality is that every time I do this, usually about 20% will stumble on the right answer and 80% get it wrong. And 16 is the most common wrong answer. If you got 16 and didn't raise your hand, shame on you. So what if I had posed to you the exact same math computation presented this way? Complete the following. I want you to add these numbers. So 5, 7, and 8 is 20, 21, 22 plus 3 is 25. Subtract 5 is 20, divide by 2 is 10. Maybe. There we go. Add 1 is 11, right? We could all do that math. It's not a hard math problem, right? The difference is simply how the instructions were presented. That little small difference between essentially a slide, presenting the instructions on one slide versus integrating it within the actual learning task. So if we could maybe put this in an example that will be maybe more relevant to you all. What if you're educating a patient and it's the difference in you talking to the patient with the pill bottles in front of them so that you can show them the medicines, they can feel the medicines, see the medicines versus not. That's a very real life example of what I just showed you here. The reason I'm showing you this though is to ask the question why. Well, why is it that this was so much harder when posed the former way as opposed to the latter? Let's do one more just because it's fun. How many words on the following slide can you remember? All right, go ahead and repeat to yourself all the ones you could remember. So statistically, you will all remember at least 3, probably at most 5. Some of you will remember a few more, and usually those that remember more are pretty astute and memory tricks and mnemonics, so to speak. But what if I had presented the information to you this way? I chunk it into 3 different buckets that are relevant to us. We have dogs, birds, and pigs. Statistically, if we were to do this test on hundreds of people, what we would find is that when we chunk the information like this, we remember almost all of these 9 words, as opposed to when we space them out and don't have any sort of meaning or logic to it. At its core, this is cognitive load theory. We're talking about information processing when we talk about cognitive load. And so I want to introduce a few key terms to you that we're going to go over throughout the presentation. And the most important one to remember is working memory. Working memory is sometimes referred to as quote unquote short-term memory, which I'll talk more about in just a moment. As you're sitting here in the seats, so you have many sensory inputs right now, right? You feel the air that's coming by. You hopefully are listening to my voice or at least hearing it. You're seeing what's on the screen. You're feeling the seat that you're sitting on. Almost all of those sensory inputs are quickly lost. You don't even think about them consciously. A very small portion of sensory input goes to what's called working memory, which is short-term memory. So when I was asking you to remember those words, for example, you were storing those words in short-term memory. The only problem is it's called short-term for a reason. You can only remember about 7 pieces of information, give or take 2. Some would even say it's less than that. The vast majority of what goes into working memory is lost. Guess what, guys? You're not going to remember much of what I say today. So I've been very careful to curate things into something that I hope you can leave with and apply whenever the time is relevant to you. But the reality is this is true in almost all of our teaching. Most of what is said gets lost. And so we have to be careful in how we deliver the content and how we prepare it. Now, what makes it from working memory to long-term memory is only done through actually deliberate rehearsal and quote unquote desirable difficulties, things like reflection, elaborative rehearsal, talking about it with somebody. Those are the types of things that get it to long-term memory. We can then retrieve it from long-term memory to put it back in working memory when we need to use it. But the vast majority gets lost. At its core, cognitive load is concerned with working memory. If we were to define cognitive load, it would be the demand placed on the information processing system. But in particular, it's working memory that we're concerned with. We can subdivide cognitive load into 2 main kind of buckets, if you will. The first of these buckets is what we call intrinsic load. This is the inherent difficulty of a learning task. When I asked you to perform the math computation, It wasn't a hard learning task, right? We could all agree that we can do that. But what made it difficult was this other concept known as extraneous load. Extraneous load, by definition, is not beneficial and it actually detracts from the learning process. So by simply putting the instructions on a separate slide that you had to remember, you were unable to perform the learning task that was at hand. It's a very simple scenario and example, but it's profound when you think about the implications on a more broad level. Again, if we're kind of an image to go along with this, the intrinsic load with each of these was quite small, but in the first math computation you did, extraneous load was very high, and we call this cognitive overload. By definition, cognitive overload is not a good thing. We want to prevent cognitive overload because anytime we overwhelm the working memory system, that eats in to our essentially our brain's capacity to do some of the deeper processing, like elaborative rehearsal and those desirable difficulties that store and or that commit things to long-term memory. In the latter math example, again, extraneous load was kept at a minimum, and we have all of this extra room to do the kind of raw learning that we want to. Dylan Williams is an educator and a researcher, and he once said, "I've come to the conclusion that cognitive load theory is the single most important thing for teachers to know." And I'll be darned if I don't think he's right. And this evades not just education in the classroom, but precepting, counseling patients, and so on. So I promised I wouldn't talk about cognitive load theory itself too much. I want to talk about the application of this, because at the end of the day, this is what I want you to leave with and pull out the next time that you're doing some sort of education, be it PT rounds with patients and so forth. The way that I frame this is through a series. I'm gonna start with a series of reflection questions for each of these key principles. And I'm not gonna ask you to raise your hand and tell me about it. I'm just gonna ask you to think of a scenario where this might be applicable. I'm also gonna use the term instructional materials, which probably isn't a great term to use. When I say it, I mean it in the broadest sense. It could be in the classroom. It could be with residents or students on rotation. It could be with your patients. So this first question is, how often do your instructional materials require students to split their attention across time, space, or both? As you're thinking about some examples, you might be like, well, what exactly do you mean by this? So I put a patient case up here. This is my own patient case, so I'll just call myself out right now. And we've all been to a CE presentation that pulls out a case like this and in like 30 seconds flies through it and then asks you the dreaded question. Which of the following is most appropriate, right? There's four options up here. The absolute, like definitive, objective right answer is I don't know, because I can't remember everything on size 2 font on the previous slide. This is a classic example of what we would call split attention. We have violated the contiguity principle, which means when we separate the instructional task across time and space, we're less likely to remember it, and we're less likely to be able to work with that information. So don't be this person, okay? Don't be me whenever you create your patient cases. Here's another example. Cardiology is my clinical expertise, I guess. And when I teach electrocardiograms to the residents and the students, I could teach some of the fundamentals doing kind of two different approaches. The first would be, well, I can explain what each of these are by labeling them A, B, and C, and then I can put down here in kind of a legend what they mean. Or I could integrate it, and I could put precisely what they mean within the figure. These seem like small differences, and part of why I love cognitive load so much is because it's more than just a theory, it's a science. In fact, if I were to show you some of the initial studies with cognitive load theory, students that learned using this integrated approach, 80% of them scored better than those who had a non-integrated approach. And so there's science to back this up, there's data to back this up, which is one of the things that I think is so cool about it. This is known as the split attention or the contiguity principle, which is what I just referred to as. Again, another example is if you're counseling a patient. I struggle with this all the time. Patient comes in with ACS and I want to counsel them on their 5, 6, 7 different medications, but I don't have their medications at the bedside. The educator in me hates that, right? Because we've essentially violated the split attention principle. Let's stop here. Are there any questions? Keep rolling. Think back to the math example. This too was an example of split attention or contiguity principle being violated. Another reflection question, in your instructional materials, where can you cut down on redundant information? I'll give a couple of kind of broadly applicable examples here. We've all seen a graph like this. It shows the hierarchy of evidence and various trials and so on and so forth. I can present this graphic and tell you about it, or I can present the graphic, tell you about it, and also give you the text. Just curious, like, which do you all think is better, including the text or not including the text? I hear a lot of not including the text. You know, a common thread throughout cognitive load theory is less is more. And this is absolutely one of those scenarios. Not including the text is actually superior to including it in terms of what learners remember, both in the short term and the long term. Now, I want to insert just a strategic pause here. This is not inclusive of those that might have accommodations that require them to have transcripts and things like that. That's a totally separate entity. So I don't want you to conflate those concepts. I'm talking kind of in the absence of that. Here's another example, right? We've got the anatomy of the heart. And when we talk about the physiology or blood flow through the heart, again, I can walk someone through it step by step, or I can also include the text. And at the end of the day, it takes us much longer to process text than it does spoken word. And so when able, we can cut down on this redundant information. This is known as the redundancy principle. Eliminating redundant material actually reduces extraneous load. Remember, by definition, it's not just extraneous load doesn't contribute to learning, it's that it actually detracts from learning, which is the concerning part about it. All right, reflection question. How often do your instructional materials contain information, graphics, and animations that don't directly contribute to learning? All right. Hopefully you all catch the irony of this, right? With the thinky face. All right, this is really common to include little emojis and graphics like this, but is this contributing to learning? If I had to guess, actually, you all reflected less on this question because I included that little emoji. In actual fact, that's probably true. This is known as the coherence principle. I want to talk about something called seductive details. These are those things that we insert within a slide that like we think are attention grabbing and we think are like, oh, this is cool and fun. When in actual fact, these detract from the overall learning. Now there's a balance here, right? We want to be engaging. I don't know if Dr. Watson's in the room. Is she in the back? I'm going to give an example. Dr. Watson, when she talks about goal-directed medical therapy and heart failure, she has this train analogy, and she talks about the kind of four. I'm gonna say the wrong word, Dr. Watson, but okay. But she talks about the 4 pillars of GDMT, and she uses a train analogy for it. That's actually a great example of anchoring some prior knowledge to new knowledge that we want them to gather. So that is not what I'm talking about. What I'm talking about are these little things that we include on slides, and I'll show you more examples later on. So there's a balance. There are ways to be engaging and include things that are fun and animated, but we have to balance that and make sure we're not kind of venturing into the seductive details. Again, this is known as the coherence principle. All right, another reflection question. In your instructional materials, where can you replace textbook explanations with verbal explanations and well-designed graphics? This is where I talk about arrhythmias, Dr. Parboni. Can you tell me about reentry? All right, so when I was more junior than I am now, I used to teach the pharmacy students about reentry using literally this textbook explanation. And like, I legit went to the copier and copied this page and included it in my materials. And for years, students didn't get it. And I thought to myself, what is wrong with these students? And then I realized it is not the student, it is my instruction or lack thereof. Textbooks have a place. All right, hear me out. Textbooks have a place in learning. But we have to be very careful because they're notoriously bad about essentially causing cognitive overload. Why? Because it's only written text, which, as we just said, requires a lot more cognitive effort than spoken word. But then they also tend to violate a lot of the principles of cognitive load. Classic example. If you look at these, you'll see a bunch of Greek letters throughout, and then you'll see the explanation in like, I think that's size 1 font. I don't even think that's size 2. You'll see it over there on the side, right? All of this requires cognitive effort. they have models where you can look at eye tracking motions. And the more eye tracking you have, that correlates directly with cognitive load. And I think if you were to do an eye tracking study on this, you would see that cognitive load is through the roof. On top of this, this is a notoriously challenging topic. The intrinsic load of this topic is very high, meaning the inherent difficulty is very hard. And so you can try to water this down as much as you can. But again, the bottom line is a textbook explanation is not the way to go with this. So what have I done now? Well, I've scrapped the textbook. I used to include it as a supplemental. I don't even do that anymore because it was worthless. What I do now is I draw it out step by step. And I, using the graphic kind of with voiceover, talk about what reentry is and how it works. Students still struggle with it, but far more understand the basic premise than used to. This is known as the modality principle, all right? So I put together an infographic, and this outlines some of these key principles that I've just went over. Dr. Parbuni, I'm going pretty quick. I hope that's okay. I'm doing it in the sake of cognitive load, though. I can always say that when I go quick on this presentation. So don't worry, there's more. We're not going to end 40 minutes early. It's okay. So I've given you access to this handout through Slido. And what I hope is that whenever it comes time for you to present something, to talk to a patient, anything that might require education, you'll kind of pull this out and just kind of like through the lens of cognitive load, think about each of these various principles and how you might be doing them well or doing them not so well. And so I hope you'll make use of it. Just to highlight a couple of these on here that we've talked about. Here's my pen. Let's see if it works. Probably not. Oh, well, that's not right. Okay, we won't do that. So just a couple that I want to point out to you. We talked about the coherence principle, which is, remember, eliminate unnecessary or irrelevant graphics or data. We'll talk more about that in some of our examples. We talked about contiguity principles. This is one of the more, powerful isn't the right word, but if you look at the effect size of these various principles, contiguity is one that has the greatest effect size, meaning the most profound effect. I didn't touch base on a couple of these, segmentation principle and pre-training. Segmentation, when I have a patient that comes to the hospital with, let's say, a STEMI, I know their course of stay, assuming it's uncomplicated, and that within 72 hours, they're going to be gone. And a lot of the time, our STEMIs that come in weren't on anything beforehand, and this is all foreign to them. So I'm very deliberate in seeing them on hospital day 0 or 1. And what am I doing during that initial kind of interaction with them? Well, I'm kind of orienting them to, one, who I am, but more importantly, hey, you're going to leave here probably on 5 to 6 different medications. And here's broadly what they're going to do for you. And I might introduce the names of the medications, but I leave it at that. It's in small chunks. And then I strategically revisit them on day 2 or day 3 and go into more detail about this. What am I doing? I'm doing 2 things. One is segmenting, right? These patients get overwhelmed so easily, and it's completely understandable why they would. And so breaking it up into segments actually improves the overall retention and learning. But the second thing is I did pre-training. Whether or not you know it, when I asked you to do the pre-test, that was a form of pre-training. I was deliberately introducing some of these concepts and phrases that you may have never heard of, but I did it so that way when you saw them in the presentation, they weren't completely foreign, just a little bit foreign. Those are 2 very kind of real-world examples that you can use in your day-to-day. All right, I'm going to show you one more slide here, and then we'll do some examples. So actually, as I was putting this together this afternoon, I realized it's probably cognitive overload, but I didn't have time to fix it. But the reason that I'm showing you this is because I want you to see the effect sizes. And Cohen's D isn't something we talk about in like New England Journal of Medicine studies and things, but in educational research, it is something we talk a lot about. And I want to just kind of help you understand what these mean. So just forget everything there and focus on this example here. If we have a Cohen's D of 0.8, that indicates that about 80% of people in the control group performed lower or worse than those in the experimental group. So what do I mean by that? We kind of go back to, if I go back to this, think about a Cohen's D of, let's say, the redundancy effect. The Cohen's D is 0.86. So those that received instruction that minimized redundancy, 80% of them scored better than if they violated redundancy throughout. Think about the contiguity principles with a Cohen's d of 1.1 and 1.2. We're talking like 90 to 95% of the people did better than if those principles were violated. What's my point? My point is this is significant, and we probably don't talk about kind of the data and the science behind some of why we recommend what we recommend in education. And so I just want you all to know that the evidence base you're using in practice, right, it translates to the classroom too. It just looks a little bit different. And this is one of those ways I think that you can incorporate it. If you go to Slido, if you would, I actually want you to do this because we're going to need the infographic for some of the examples we're going to do in just a moment. So if you go to Slido, you'll see the little menu icon, and then you'll see something on the left-hand side that says infographic cognitive load. And when you click that, it should pull up the infographic. And you might need to turn your phone, you might need to zoom in some, but you should be able to see it. Everyone able to access it okay? No one's screaming at me, so I'm assuming you can. All right, so we're going to do, I'm going to go through, we're going to walk through some slides together. Does anybody know Alec, former resident? He was here, yeah, you know Alec, right? He's lovely. He's not with us anymore, unfortunately. But I reached out to him and I said, Alec, you did, sorry, he didn't die. He didn't die. He didn't die. He's back at Duke, which I won't hold against him as a Kentucky fan. Actually, I probably will now that I think about it. But Alec did a tremendous job on his PT rounds. And I don't know, he had a great mentor, I guess. I don't know. He did it, I'm kidding. He did a tremendous job on his PT rounds. And I got to see the before and after of his slides. And we talked about cognitive load. And I said, hey, see what you can do to incorporate some of these principles. And my gosh, he did a tremendous job with it. So I asked him, I was like, can I use some of your slides and use it before and after? And he said, yes. So he gave me permission. I am not like calling out Alec. In fact, if anything, I'm gloating about how great he did. This is one of Alec's initial slides. And to give context, Alec's PT rounds was on statin-associated muscle symptoms and some recent data that's come out around this topic. And with this particular slide, he was trying to demonstrate the difference in real-world SAMS rates and clinical trials SAMS rates, so to speak. And so this was his initial slide. And I said, see what you can do using cognitive load to kind of help this slide some. So what I want you to do is use the infographic that you have in front of you now, hopefully. And I want you to think about some of the principles that could be applied better to this to make it more, to reduce the cognitive load, essentially. So I'm going to give you a moment to think about that. Does anyone have any thoughts or particular principles that you think could be employed? And if it makes you feel any better, like I literally still refer to this document because I forget all the principles too. Yeah. By getting rid of the what? The graphic. Okay, the graphic could be considered extraneous information. Which principle would that be? Probably coherence principle. Yep. Any other takers? That's a good answer, by the way. Good answer. Okay. Oh, yes. There's a little mic here with a green button, and they ask that we use it because it allows people online to hear us.
You could get rid of the graph altogether and maybe make a range of percentage.
Ooh.
That was like for the randomized controlled
Yeah.
trials compared to self-reported.
Yeah. So what you're saying is condense all of this data into something that's a bit easier to follow and track. I think that's great. Any other takers? All right. So let's see what Alec came up with. So this is Alec's new slide. And he did a lot of what you guys described. He put on the left, the clinical trials, 2 to 4% of patients experience SAMS. And in the real world, 31% did. Your ability to remember this take-home point is far increased with something like this than trying to include all of the data in something like this. And this is something common that we see. It's this notion or tendency to feel like you need to include as much data as possible, when in actual fact, the kind of better education move, so to speak, is to condense it using your own expertise and what you've learned throughout the process, so that the audience member, the attendee, leaves with that most important take-home point. As far as the graphic, he did leave the graphic because he actually used this for demonstration purposes. So he wanted to identify or help the audience members know kind of where SAMS is most often experienced on patients. So he did keep the graphic, but it served a purpose. Good job. All right, here's another one. I'll let you guys think for a moment about how this slide could be improved to reduce cognitive load. Any takers? Go ahead. Can you use your mic though?
It's the same coherence principle of like getting rid of the unnecessary pictures.
Sure. And another principle applies too. If you're speaking this, right? Let's say this is essentially the presenter's recap of the information, right? That would be the redundancy principle, right? If you're speaking it, why do you need to include the text of it, right? Any others? What about signaling? Signaling is one of the principles on there. Signaling is like one of the simplest things we can do, but it can actually be really beneficial if used correctly, right? So simply signaling to the learner, to the audience, what the key points are. So Alec did a few things with this that I thought were very clever. The first was he segmented it. He broke it up into 3 different sections, and he spoke about each trial as he presented the trial. And so when you think about your initial reaction to that last slide, it was like, oh my gosh, this is a lot. Like, I don't even know where to start. At least that's how I felt. With this, he broke it down section by section, and he included just those key points that he needed to. Am I in trouble, Dean? Oh, okay, good. And so he did the same for these others. He also used signaling, right? He highlighted those key things, those key takeaways, so to speak. Guys, this isn't stuff that takes a whole lot of time. To be honest, I think it takes less time to do this than to kind of type all of this out. Now, to make it look pretty in the font, whatever, like you can spend a lot of time doing that. But some of these basic things that don't take long can actually go really, really long ways in helping our students learn. All right, here's another one. Any takers? What's the phrase that I used for this image? Any takers? I can't tell if everyone knows and they're just not saying it, or if you guys are just like, I don't remember. All right, so this is an example of seductive details. The little detective, like, he's cute, whatever, but it doesn't add to the learning. So the detective, that needs to go, right? What Alec really wanted to portray here, what he really wanted the audience members to leave with is, this is how you handle a patient with SAMS. Do this kind of stepwise approach to help kind of resolve the issue and identify a statin they can be on. So the transformed version looks something like this. And he walked through step by step by step how to approach a patient with SAMS, right? When you take a step back and you think about a lot of these things, they're very intuitive, right? But it's only when you learn that like there's science to back up why we do it that you're like, oh, I need to do this now. Like this is important. All right, here's one more, and it touches on a lot of the ones that we've already talked about. All right, I'm just gonna say it. Please, 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 please do not take a screenshot of the demographics table from the New England Journal of Medicine and include it in your slides. In fact, if we don't see a single one of those on PT rounds this year, I will consider this presentation a great victory. Why do I say that? Why do I say this? Part of it's to be funny, but it's actual, like I say it because it's true. we don't learn or gain anything from seeing those tables. Unless you're an expert in that particular domain and you know exactly what to look for. Like if I'm looking at a heart failure trial, sure, I know exactly the 4 or 5 columns and rows that I'm going to look at in the tables. But outside of those select people, most people are just overwhelmed by it and don't actually know what to take from it. That's where you come in as the expert presenting this information, and your job is to distill it in a way that the learner can take it home, so to speak. So this is what Alec came up with. I was like, you rock, man. 85% were previously on a statin. 2 was the median number they tried, and 20% had trial of statins. Guys, this is easy. This is almost as easy as copying and pasting the table from the New England Journal of Medicine. What is it that you want your learner to take home? And that's what you should be including. If you're going to include a table, not all tables are bad, but if you're going to include a table, I recommend a couple things. One, try to do it in your own, like type it out yourself instead of just copying and pasting or screenshotting, because it's often pretty difficult to read that. But more importantly, use signaling. Use signaling to highlight those key rows that you want the learner to take home. And I would challenge you, if you're only signaling to a couple of rows, maybe those are the only rows that are really important, and you can do away with the rest. All right. If you're still on Slido, we're going to do that same test that we started with. Let me go in and activate it. All right, so I've activated the post test again. Hopefully you all have access to it. And I want you to take a couple minutes and answer those questions. Then I'm going to go over them just to make sure we're all on the same page about kind of the key take homes. Good job. I'll give you guys about 30, 45 more seconds, and then we'll go over it real quick. All right, so let's go ahead and talk about the answers to these. So which of the following best explains cognitive load? So the most correct answer here is the second option, the demand placed on the information processing system. And keep in mind what the rate limiting step of information processing system is what? Blue text on the information processing. Working memory, right? So working memory is kind of that key term that I want to come to mind when you think about adding more information to your content. The amount of energy it takes to learn something new, it was kind of, it was just a distractor. The second option is the most correct one there. All right, intrinsic load is good. Most of you got this. The inherent difficulty of learning a task. Remember, you as the instructor have some control over intrinsic load, but I mean, the difficulty of learning the concept is what it is. Sure, I might water down arrhythmias for my pharmacy students compared to my residents. We talk about it Monday, guys. But at the end of the day, the intrinsic load kind of is what it is. The overall demand placed on working memory, that's more in line with cognitive load, generally speaking, than it is with intrinsic load. Remember, cognitive load is that you can think of it as the sum of the intrinsic load and the extraneous load. And as best we can, we want to minimize extraneous load. Good. So this was, I think, a select all that applied. Instructors can influence which of the following types of cognitive load. You all did a good job of identifying extraneous load. And I would say if there's a single take-home point, it's that really focus on extraneous load. But you can actually manipulate intrinsic load to some extent, to the greatest extent that you can kind of water down the concept. But at some point you have to say, look, this is the bare minimum competency that you have to know. So good job with that. Which of the following explains seductive details? Sorry for my typo. Oh, unnecessary details that detract from overall learning. What is the right answer? Hold on, let me read this for a second. Yeah, that's the B's correct. B is absolutely correct. Though we might think of them as engaging, they're at the end of the day, they're actually detracting from the overall learning process. You guys are like, who's doing this? He doesn't even know the right answers. All right, an instructor uses the provided slide as part of a lecture, and which of the following principles is violated? I suspect most everyone got this right. Good. Redundancy principle is the biggest thing that is violated. Oh, only 62%? Man, I failed. Okay. Yes, so this should be like 100%. We don't want to include the text and the narration. We just want to narrate it. Now, if you're saying, all right, I want you to make sense of this, I'm not going to narrate it to you, this isn't a multimedia presentation, then fine, you can include the text. But if you're going to be speaking this, there's no sense in including it. Less is more. All right, and another example, which of the following principles is violated, or which of the following would be best? Good, 92% got this right. So indeed, when I present the clotting cascade to our pharmacy students, we do it in a step-by-step fashion, and as opposed to showing them everything at once. So when I showed you all the information processing graphic, or walk through walking memory and the different inputs, that's actually an example of kind of walking through step-by-step a graphic. I showed you kind of the big picture, but then we honed in on each of the processes. And again, that's one of the more, I guess, one of the principles that has the higher effect size associated with it. All right, so I'm going to stop there. What questions do you have, if any? Everyone's afraid of people still. It's week one. I can't speak out. Yeah, can you just be sure to use your mic?
So how do you apply these principles when you're giving a presentation that has a minimum set of requirements that might violate those principles?
I talked to the person giving me the guidelines. No, so it depends, right? I mean, we're talking in kind of generalisms, but I think you do your best with what you're given. If it's truly a requirement, I find more times than not, I reach out and I say, hey, I want to do this, and here's why, and here's some of the data I have to back it up, not in a like flaunting sort of way, but just in a, hey, I want this to be as effective as it can be. And I think including 100 slides in 50 minutes isn't a good use of, people's time or an effective way to learn. I'm just giving a general example. Did you have something more specific in mind?
Well, for example, like sometimes when you're giving a presentation about a journal.
Ah, yes.
And you are required to give these key pieces of information in the results section, like putting table 1, the demographics.
Yeah.
And
so for like a journal club
presentation, so many times to include it. So
yeah. So you're alluding to a journal club presentation, right? Yeah. So it's funny because the cardiology group has gone away from this, like requiring PowerPoint slides and a handout because of some of this cognitive load stuff. And because at the end of the day, like we've all read the article, it should be more about discussion than just somebody presenting at us for 20, 30 or more minutes. I think that's something, feedback you could provide maybe to the, whoever's leading it, the RPD, the preceptor, whatever. But again, explain your rationale behind it. I agree. Journal club presentations they can be very dry, and sometimes the requirements are a bit stiff. We actually put very strict time limits on our students that are giving journal clubs. We're like, no more than 15 to 20 minutes to talk about it. The rest of the time is just general discussion. Good question. Other questions? Hi.
I actually do have a question. So when creating for lectures in more of like an academic setting where this lecture is going to be distributed, and while you want to cut back on text and some of those redundant principles, how do you feel about adding some of these notes and things to like the notes section of the text, or providing some kind of, for, when they go to their next class and their next class, come back, look at this and say, what did they say again? Because I think that the text is distracting in the moment, but what about the after piece, I guess?
Yeah. So I think the onus should be on the student to take the notes. And I say that for a couple of reasons. The first and probably most important reason is the act of the student hearing the information and putting it in their own words is actually directly contributing to their learning. And you providing the notes to them in that kind of note section, you're actually taking away a really valuable part of the learning process. So writing notes is actually one of those desirable difficulties if it's done well. If you're trying to write down every word the instructor says, that's not what I'm referring to. But those kind of broad take-home points and those caveats that instructors really emphasize in class that might not be on the slide themselves, those are the types of things that students really should have the onus of writing down on their own. Does that help?
It does. I have received things and used things in the past where like these really long drawn out definitions and explanations
Sure.
are kind of in that section. So I
Yeah.
just was curious on the,
Yeah.
utility of it.
I'm not saying you absolutely shouldn't, but it feels like the exception more than, what should be done all the time. Yeah. Yeah, exactly. Good question. Other questions? Yeah.
Similar question, but one posed in the chat. How would you handle organizing a presentation that is meant to be delivered orally, but also meant to later be a written resource for people that couldn't attend the live presentation? Would you make two different sets of slides?
No, I use appendices or supplemental stuff. So if I'm giving the presentation orally, usually when I give a presentation, I'll have a parking lot section at the end or like a supplemental section in PowerPoint, and I'll throw stuff in there if I think it's useful for later. But I generally, if my primary audience is in front of me and I'm trying to engage them in some sort of presentation, I view it all as detracting from the learning. So no, I generally don't whenever I'm presenting it orally. But it's easy enough to throw in the supplement, like the infographic, for example. That's something you can throw in as a supplemental, easy enough. It's a good question. Is there anything else in the chat that I can't see? Anything else? Yeah.
So in a classroom setting, what would be your stance on telling your class beforehand, like, oh, this is something that you'll need to know, like watch out for this, or after you've given the information, say this is something that I will test you on, this you have to know. Like what would be your stance on that?
That sounds like signaling. I'm serious, like a good thing. It sounds like signaling. Like, no, I'm not going to sit there and read the test to you, right? But remember, there's key things that we want the learners to know. And I think just like at the end of this, we did kind of the post test, I really drilled home those things that I thought were most important to know. I mean, instructors use that sort of signaling all the time. But there's a difference in that and like kind of hand holding and coddling, if that makes sense. But what you presented sounds a lot like signaling in a positive way. Dr. Watson?
Can I just add something? I was got something to say. You'll hear me in a little bit. But one thing that I do to help write the learning objectives, which Dr. Noel has taught me how to write my learning objectives so well, is like sometimes I'll even give students like examples on how I'll turn some of the learning objectives into self-assessment questions to help them narrow in on some things, because, and I think one thing is important is really writing those good learning objectives. And when you write your assessment questions, is that we put our learning objectives up on one screen and our questions up on the other, so that they are certain, right? So that you're making sure you're really testing them or assessing them from what you told them you would be assessing them on. I don't know if that helps or not. But.
Yeah. And if I could piggyback off of that from a cognitive load perspective, one of the things that I've adopted to try and help keep me on track with the learning objectives is at the bottom of my slides. It's not in this because this presentation preceded when I started doing it, but I actually on each slide try to put the learning objective at the bottom of it. So that way, every slide I'm thinking, okay, how does this tie back to the learning objective? And so I have it in small font at the bottom as a reference to the learner, but also kind of as a reference to me to stay on track and not include those kind of miscellaneous items that I think are fascinating and important, but really aren't the focus of the presentation. Other questions? Are we on academic time or on, we are, so we're perfect. I didn't even end early. All right, cool. Thanks, guys.